attendees are in listen-only mode.
Good afternoon. I'm Kathy Guidry, and I'd like to welcome you to the Dibble Institute's second Wednesday webinar called Best Practices for Serving Youth in Healthy Marriage and Relationship Education Programs. Our presenter today is Dr. Mindy Scott with Child Trends. Hi, Mindy.
Hi there, Kathy. How are you?
I'm doing good. I'm so glad that you're back to present for us. Thank you. I want to go through.
Good to be back.
I want to go through a little bit of webinar information, kind of a little housekeeping tips for you. If for some reason the audio goes out on your computer, you can use your phone. You might want to write that phone number down and the access code. During the webinar, the attendees are muted. There is a question box, though, if you look in your control panel, and feel free to, if you have any audio questions or anything, to write that in the question box. I do ask that if you have questions about Mindy's presentation, that you wait until she's finished and then write those in the question box so that we won't miss any of them. If we do run out of time at the end, either Mindy or I will be in contact with you, and we'll be glad to answer your questions. Also today, Mindy has a handout for everyone, and if you look in your control panel under handouts, you can actually download that. And I think that Mindy will mention that again, and that will be helpful for you to have even after the webinar is over. I am recording the webinar, and we will have it archived at the website or at the link that you see at the bottom of this page, and it should be up by probably Monday. So feel free to go back and look at it and share it with your colleagues. Before we start with Mindy, I want to talk a little bit about the Dibble Institute for those of you that are not familiar with our organization. These are our founders, Charlie Dibble and his wife Charlie. Charlie Dibble and his wife Helen, Charlie was an engineer by trade, and like most engineers, he really liked to see solutions. Some 30 years ago, he saw how young people's relationships and how those of their parents were affecting the outcomes of young people, and not all in a positive way. So he began by asking lead experts in the field of relationship education, what are you doing to convey to young people the need for creating stable families? So it was with the lack of strong answers that Charlie decided that it was necessary to take research and supply materials to young people that would enhance their romantic relationships. So here the Dibble Institute is, 30 years later, helping young people to have access to relationship education materials. Dibble is an international, independent, nonprofit, research-based organization. We are able to reach many young people thanks to your efforts in partnering with us. We could not have reached the more than 1.5 million young people that we have in the last 10 years without you. Thank you for all your help and dedication. I'd like to talk briefly about the core values of the Dibble Institute. First and foremost, we believe in research, and we go where the research leads. We base our materials on what the research tells us. It is important to Dibble that we keep our materials up to date with the most current research. Secondly, we believe in stable, healthy families. Although we know there are trends, we follow the research. Research shows that children do best when raised by their own two parents. Research also shows that children do best when parents are together. We do understand that not all families have two parents. There are many single parents who do great jobs and have great outcomes with their children, but we do know how difficult single parenting can be. We also do believe that high conflict, abusive situations are not good for children, and those relationships are better being apart. Finally, the Dibble Institute believes that all young people, deserve to be treated with respect. All relationships get better, stronger, and healthier with relationship education. Our materials are suitable for all kinds of relationships. I would like to introduce Dr. Mindy Scott now. Mindy is a senior research scientist at Child Trends. She's going to tell us a little bit more about Child Trends when she begins her presentation. She is involved in a number of research and evaluation projects focusing on healthy marriage, responsible fatherhood, and teen pregnancy prevention. She has conducted research on one, adolescent and young adult relationships, two, the association between adolescent risky sexual behaviors and young adult reproductive health outcomes, and three, healthy marriage and relationship education for teens and adults, with a focus on youth in foster care, complex families, young males, and other vulnerable populations. And Mindy, I'm going to turn it over to you. It'll take me a few minutes to do
that. Thanks so much, Kathy. All right, thanks, Kathy, and good afternoon, everyone. I'm going to pull up my slides here. How's that looking?
Good. We just need them in slide mode whenever you have a chance. There you go. Perfect.
Okay, great. Well, thanks again. And today I'm going to be presenting some findings from two studies that Child Trends conducted. They were funded by the Office of Planning, Research, and Evaluation. And these projects focus on really trying to better understand healthy marriage and relationship education programming and best practices that are being used in the field to serve youth. Before we talk more about that specific work, I wanted to give just a brief overview of my organization, Child Trends. Child Trends is a nonprofit, independent research organization that works to improve the lives and prospects of children and youth by conducting high-quality research and then sharing the results of that research with diverse audiences, including practitioners and policymakers. And we have a number of principles that guide all of our work that are listed here. First, we take a whole child approach. So we look at all aspects of development and all sort of contexts and factors that influence child well-being. So looking at family, looking at schools and early childhood, looking at all kinds of domains of influence on child well-being. We study children of ages and social groups. We seek ways to help children flourish, and so this is really an emphasis on looking at strengths and protective factors rather than always looking more at risk factors. We value objectivity and rigor in our work, and we pursue both knowledge development as well as knowledge transfer, so really focusing on disseminating our information and reaching key stakeholders. And we bring to our work expertise in diverse methodologies and broad research topics, including youth development, early childhood, parenting, and reproductive health and family formation. And you can get more information on Child Trends at our website, childtrends.org. I also wanted to give a little bit of background on our funder, the Office of Planning, Research, and Evaluation, or OPRE. OPRE studies programs that are supported by the Administration for Children and Families and the populations that are served through rigorous research and evaluation projects. The types of projects that they support include evaluations of existing programs and also evaluations of innovative approaches to helping low-income children and families, also research syntheses and descriptive and exploratory studies. And here are a number of areas of research that OPRE focuses on, including welfare, employment, teen pregnancy prevention, responsible fatherhood, youth development, and for our purposes today, most importantly, healthy marriage and relationship education. And also for more information about OPRE and their projects and priorities, you can get more information at their website, which is linked here. So to get back to the work on the OPRE and Child Trends has been, this work on healthy marriage and relationship education, or HMRE, for youth specifically, is motivated by key principles drawn from existing research and theories about the importance of romantic relationships during adolescence and young adulthood. It's important to keep in mind that romantic relationships are quite an important part of adolescent development and are very appropriate for that developmental stage. Romantic relationships help shape a variety of behaviors, whether positive or negative, during adolescence. For example, helping to establish more positive and supportive peer relationships, or on the negative side, unhealthy romantic relationships can lead to youth engaging in more risky sexual behaviors. Adolescent romantic relationships help to contribute to identity development during adolescence and can also influence romantic relationships later on. So thinking of relationships that are. So given the importance of romantic relationships for youth, healthy marriage and relationship education programs can help to shape the experiences that adolescents have by improving their attitudes and their expectations for healthy relationships, and by helping youth develop to relate unhealthy. Youth have been an important target population for HMRE interventions. Approximately half of the cohort of HMRE programs were funded by the federal government. The Office of Family Assistance in 2011 served youth between ages 14 to 24. And about half of all of the participants across all of the programs funded at the time were under the age of 18. So large focus on younger youth, kind of high school age youth, 14 to 18. However, the extent to which this cohort of programs really tailored their services to meet more the specific and unique needs of youth using established best practices from research and evaluation hasn't been documented systematically until now. Recently, OPRE contracted with Child Trends about a year ago to address this gap and help to document HMRE programs for youth through a project called the Youth Education and Relationship Services Project, the YEARS project. So this project that I'll talk about today is really designed to address this critical question of how HMRE programs are implemented with youth. And we do have a publication from this project, and that's the handout that Kathy mentioned, a YEARS fact sheet where we describe youth serving HMRE grantees, and you could download that from the webinar platform. In collaboration with OPRE, as part of the YEARS project, we identified 3 key objectives. First, to simply describe the organizations that are implementing HMRE programs with youth and describe the services they provide, and also look at the characteristics of the youth that are being served by these programs. We are also working to assess the alignment of HMRE programs for youth with best practices that we have identified from HMRE relevant fields, and I'll go into more detail on the approach we use to identify those best practices next. And then we will work to synthesize our findings by promising approaches being used or could be used by grantees to more effectively serve youth. So getting more to the approach work, we drew from a number of existing resources to identify best practices that are recommended for serving youth, including some previous Child Trends work with OPRE and also other published findings drawn from research and evaluation focusing on adolescent relationships as well as positive youth development. And these resources include a number of reports focused on HMRE programming for youth, synthesis of research and evaluation literature, like I mentioned, focused on adolescent relationships, also literature focusing more broadly on positive youth development approaches, and then a logic model for youth serving HMRE programs that Child Trends developed as part of another project called Healthy Marriage and Education. And I'd like to give you a little bit more background on that project and how it helped to lay the foundation for the YEARS project. So the Healthy Marriage and Relationship Education Models and Measures Project, or 3M as we've nicknamed it, was also funded by OPRE and was conducted between September 2013 and June 2015. And this project helped to extend HMRE research and evaluation supported by the Administration for Children and Families in a few different ways, by identifying priority target populations, including youth as a specific target population, developing research and practice-based logic models, and then also coming up with some recommended measures for assessing outcomes for HMRE programs for youth. So looking at the specific types of outcomes that these programs aim to change for youth specifically. As part of the 3M project, we started by developing a theory of change for HMRE for youth. And the 3M project focus specifically on younger youth, ages 14 to 17, I should mention. So much more of a focus on younger youth or high school age youth. And for this work, we approached the theory of change thinking about it as a way to broadly describe how we thought HMRE programs will lead to the desired outcomes of those interventions. And the theory of change helps to answer questions such as, what is the desired change that you're looking for? What is a program doing to actually achieve that change? And then what changes do you expect to see along the way that lead to your ultimate outcomes? And here's an example of the theory of change for healthy education for youth. And you can depict the theory of change visually or described in words, and here we have it shown both ways. So ultimately, the goal of for youth is to foster healthy relationships throughout adolescence and healthy relationships more long-term into young adulthood and adulthood. And we conceptualize that that goal would be met by helping to build knowledge to recognize the characteristics of healthy and unhealthy relationships, shaping youth beliefs that they can create healthy relationships and avoid unhealthy relationships, and then applying that knowledge and those beliefs and attitudes to ultimately provide opportunities to learn and practice actual skills needed to form healthy relationships and avoid unhealthy relationships. Again, both during adolescence and then also into young adulthood. Then, building on the theory of change, we focus on developing a more detailed logic model. And a logic model is basically a detailed version of the theory of change that serves as a visual representation of how a program is expected to work or to operate. Here is just a basic template outlining the basic components of a logic model, which include inputs, program activities, outputs, and outcomes. And just a little background on each of these areas. Inputs refer to the resources that a program uses to achieve the goal of the program. Some examples include staff, funding, equipment, so the resources, things that are put into the program to help to run it successfully. Then program activities are more of the formal organized events or activities or services that the program provides drawing on those resources and using those inputs. Then we have outputs, which are the product of the program's activities. Examples of outputs include the number of classes taught or the number of participants that are served in a program. And then finally, we have our program outcomes, which are the benefits that participants are expected to receive during or after involvement with the program. And this goes back to the theory of change, the types of outcomes that we expect to see. They could relate to knowledge, skills, attitudes or values, or actual changes in behaviors. And also important to note that the benefits of a program may be observed in the short term, either during or soon after completing a program, but they also may represent longer term outcomes that you will program affecting the behaviors and different outcomes longer term. So thinking about HMRE programs during adolescence, linking to longer term on young adulthood and adulthood, or healthier relationships in young adulthood or adulthood. So here is actually, there's a lot of information here, but it's actually a more simplified version of the logic model that we developed for high school age adolescents, so 14 to 17-year-olds. And we start with our goals for the program, the theory of change shown at the top, and then provide recommendations for specific program inputs, activities, outputs, and outcomes based on a synthesis of research and evaluation literature. And we tried as much as possible to tailor all of the components of the logic model to our specific target population. So really thinking about some unique approaches for working specifically with youth. For example, one input we have here is to have facilitators who are motivated and comfortable with the program content that is youth focused, but also able to build rapport specifically with a youth population. I want to just look at the outcome section of the model. Here we have outlined some of the short-term outcomes that I just mentioned that you would expect to see during or soon after completing the program, but then also intermediate and longer-term outcomes for adolescents that focus on knowledge, attitudes, and skills related to healthy relationships, but also other components of HMRE programs for youth, including improved college and career readiness and enhanced social skills. So thinking about the types of relationship skills that may benefit any type of relationship. So thinking about peers or teachers or family members, not just romantic relationships, because these HMRE programs can help to improve kind of those general social skills needed for any interaction. If we do think about some of the specific types of romantic relationship outcomes identified, these also could be skills used in other relationships though, but we're thinking about healthy relationship outcomes such as improved communication skills, knowledge of what a healthy romantic relationship should look like, and also reduce victimization and perpetration of violence in relationships. Okay, so now let's get back to the approach we took for the year's project, which built on the 3M logic model that we just reviewed. And we took the information from our logic model and the other resources we developed to come up with a set of specific criteria that were research informed and evidence-based when possible to sort of describe how HMRE programs for youth are being implemented and whether they are following some of the practices that we identified from this work. I do want to note that not all of the criteria that we're using have been empirically proven to work through rigorous evaluations at this point, but they're a reflection of the kind of current state of the literature and perceived promising practices or best practices across multiple fields that focus on serving youth. So integrating things like youth development and positive youth development approaches with healthy marriage and relationship education approaches. So the criteria that we use as three main areas of implementation. We first look at the curricula being delivered, and some elements of this include whether there's a logical sequence to the lessons in the curricula, is the content general enough for a broad range of youth, particularly if programs are serving all youth in a grade or in a school, is the curriculum appropriate for a broad range of youth. We also look at factors related to staff attributes and skills. Some examples are whether staff are well trained in the particular curriculum being delivered, do they create a welcoming environment for youth, and then organization practice. So things like an organization has adequate materials to implement the curriculum, or whether staff are adequately supervised and trained. And we'll see a few more examples of these different best practices criteria when we look at some of our actual results from the project. So to assess the use of best practices, we are analyzing data from several data sources, pre-existing and new data sources, to inform this assessment. We analyze grantee documents and annual performance data from the 2011 cohort of federally funded HMRE programs. And we also collected new data through a web-based staff survey that was completed by 37 respondents, which represented about half of the grantees that were funded in 2011. And then among these grantees, we had responses from directors and facilitators. So we had reports from 29 program directors and 8 facilitators, which helps us get information from kind of 2 different sources of staff from a program. We're also in the process of conducting site visits with a number of programs where we will meet with program directors and program facilitators, as well as community partners when possible, and then also conduct observations of actual program participants. You can see how the programs are. And the results today are mostly drawn from the staff survey, the web-based staff survey. I do have a little bit of information from the performance management data as well. So I should say that these results are quite preliminary at this time because we don't have all of our data collected, and once we have everything finished, and I'll talk about some next steps, then we'll have a more complete picture of how these programs are running. But for now, we can use the responses from the staff survey to start to describe the HMRE programs for youth at least. So I want to focus first on characteristics of the grantees themselves. And here we see that the majority of grantees describe their organizations as local nonprofits or other types of organizations. And the most common type of other organization were universities. And then a handful of other grantees were either for-profit organizations, were national nonprofits, or local schools. Programs were implemented in a variety of settings, but primarily in community-based organizations, schools, during school day. And other less common settings included after-school settings, clinics, or a number of unspecified locations for just on average, grantees reported having about HMRE programming to youth, although this number ranged from 1 to up to 40, so you can see a very diverse range of staffing and size of these programs. Staff from the sites where the program was being implemented were most often serving the facilitators of the program, including teachers when programs were implemented in schools. But almost half of the directors that responded were using staff from an outside organization as well and bringing them to the site to implement the program. And 5 grantees reported the use of near peers or peers to deliver the program. Part of our survey asked respondents to specify the goals or focus areas of their program. We have that summarized here, and here we look at grantees who are primarily serving high school aged youth, and we define that group as programs where 75% or more of their participants were between the ages of 14 to 17, just to focus on a specific group of programs. We'll also look at this for programs serving older youth and for those who are serving a combination of younger and older youth to see if there are any differences in the goals of the program when you have different ages of youth participating. So that does mean that the sample size is pretty low for this group, with only 6 participants serving 75% or more of younger youth. But there are a couple of initial takeaways, I think, to point out here. Some of the most frequently mentioned goals do overlap considerably with the main content of many common HMRE curricula being implemented, and these curricula exist for youth and adults. And they point to some of the priority outcomes for these types of programs, including promoting healthy romantic relationships and knowledge of what those healthy relationships look like, preventing violence and abuse, and also improving skills in areas like conflict resolution or communication. And then we saw some additional topics covered that represent other important domains related to youth relationships that can be addressed by HMRE programs. So more than half of the programs working mainly with high school age youth were addressing things like parenting and co-parenting, improving general social skills, and reducing risky sexual behaviors. I want to focus on describing the youth who participate in federally funded HMRE programming now. And the estimates that we have are drawn from 2 rounds of grantee performance data from October 2013 through September 2014, and also the staff survey. And that focused on 2014 to 2015 measures, which were reported by all grantees for a full year. Grantees served more than 30,000 youth in each of the 2 reporting periods between October 2013 and September 2014. And again, this represented more than half of all of the participants served, so more were youth. And 16 grantees served mainly youth, with youth ages 14 to 24, representing 70% or more of their total population. And the youth served by that subset of grantees accounted for more than half of all of the teens served by the grantee. So a fairly small number of grantees were really reaching large proportions of teens. And the fact sheet that I mentioned that you can download focuses on those 16 grantees, so focusing very much on programs that were primarily serving youth with their services. Then looking at the responses from the staff survey, an average of 2,700 youth were served between October 2014 and September 2015 by the subset of grantees who responded to our survey. But you also see a large range here where a few programs were serving no, but then the programs responded serving quite large numbers of youth. On the survey, we asked program directors to report on the distribution of the ages of their participants. And here we show the percent of grantees who reported whether none, less than 50%, 50 to 74%, or 75% or more of their participants were in each category. For me, the big take here is that the majority of their participants were 18 to 24. So looking at the this group are more likely to be served along with younger youth or mixed in with older adults, non-youth, which older group of youth where they're maybe not being targeted directly with programs. These findings also demonstrate something that we saw in the performance measures data as well, where a lot of grantees are serving both youth and adults, even younger youth. And we'll look more closely to see how services might be distinct for youth when grantees are serving a wide range of ages. So what grantees are doing differently for their 14 to 24-year-olds compared to the 25 and older population when they're serving such a wide range of age groups. We also asked whether grantees were serving at least 50% of youth from specific target populations for HMRE programs. Here, the reporting grantees, but then also we looked specifically at grantees who were serving a majority of youth. And so here, the serving. And we see that for these programs, so the second set of bars, the majority of respondents were serving youth that were living in poverty and youth not in any relationship, with a smaller subset of programs targeting and serving more specialized populations, including youth in relationships, parents, and victims of abuse. So just as a reminder, as part of the objectives, we invested in examining the implementation practices of HMRE programs for youth to assess whether with the best practices. The implementation practices presented provide a few more examples of the types of best practices in the assessment area that we use. We're looking to see whether programs include relevant content and materials, whether they target specific skills in their programming, and positive interactions with youth. The vast majority of grantees who responded to the survey reported that they agreed or strongly agreed that these types of practices were in place. So we see a lot of these kinds of best practices happening in programs for youth. Similarly, high proportions of programs agreed that their programs had adequate resources, had clear goals and objectives, and targeted the needs of their specific populations. And we did see a bit more variation in a question about whether programs hired facilitators with similar characteristics as the youth served, with just slightly more than half agreeing with this practice. And here is an example. Tier studies recommended, but it hasn't been proven that this approach actually works to improve outcomes for youth. A lot of researchers suggest that will help improve services for youth. Okay, we also assessed various aspects of training that was received by facilitators. Here we've ranked the results to show areas where most or all facilitators received the most training. For example, training on program content, program delivery, and group facilitation. High proportions of facilitators were trained on those kinds of topics. Fewer directors reported that most or all facilitators received training on things like communicating with schools and other community partners, or providing youth with leadership opportunities. And that's an example of a best practice drawn from positive youth development. Just looking a little bit more closely at that topic of providing youth with leadership opportunities, we asked directors to report how often their facilitators provided youth with those types of opportunities, about how many is trained in that kind of approach, and then how often the facilitators did work to provide youth with leadership opportunities. And here, again, you can see that not all grantees are implementing this practice. With about a third said that they provide these opportunities most of the time, but the majority reported that they sometimes provided youth with leadership opportunities or never provided those opportunities. The results presented are really just preliminary descriptive results that we will then use to inform our final assessment. And we do have next steps that I can review with you to help complete the project. We have some additional analyses, for example, training and gaps in training where facilitators may need more training on certain topics. We're also looking at the community context in which programs are being implemented and looking at various recruitment and retention strategies being used by programs. We have a small number of facilitator reports, but we do want to look at some comparisons of director versus facilitator reports when we have multiple reports from the same program, just to kind of get a sense of how those compare from two different staff members. And we will be completing the site visits that I mentioned, ideally this summer and in the fall. And we are looking at there's a new cohort of programs funded in October 2015. Those were funded, but and some of those programs were also funded in 2011, but some are brand new programs. We're kind of looking at a mix of refunded and new programs. And then after we complete all of our data collection, we'll synthesize the information from across all of the data sources to assess the extent to which grantees are aligning with best practices, and we'll work to develop a report and then disseminate our findings to a number of stakeholders, and definitely want to get our information out to both federally funded and non-federally funded HMRE practitioners. And then I do want to let everyone know that I will be leading a workshop on this topic of HMRE programs for youth at next week's National Association for Relationship and Marriage Education Summit. And if you're going to be there, I encourage you to come to the workshop if you're interested in more information. The workshop is Tuesday, July 9th at 1:45. The objectives for the workshop are similar to the overall objectives for the year's project that we reviewed, and some of what we'll be discussing is similar to what the workshop will be an opportunity, I hope, to provide a more in-depth look at the assessment criteria for youth and some of those detailed components of that logic model, and then really hoping to have an opportunity for audience members to describe their own experiences working with youth and what successful approaches have been identified, what has been challenging, where are there needs for improvement on directly working with youth. And then we will also look at some additional findings from the staff survey, focus more on some additional implementation components like methods used to recruit and retain youth. So I hope to see folks there. And now we can answer any questions. So let me know if you have questions or want more information. I'd be happy to respond. Thank you.
Thank you so much, Mindy. I appreciate your presentation and presenting with us today. I'm going to give everyone just a couple minutes to write down any questions you might have for Mindy. It's just really exciting to know that there is research out there on the organizations that do get the funding, or the funding that is available to them, and it just looks like that they're doing great jobs in implementing their programs in most cases. And I guess one of and that's really exciting to know, for sure.
Yeah, and it's a great opportunity to document those practices and really look in depth at how programs are reaching youth and how they're serving youth. So it's been a great great project to learn a lot about those programs.
Exactly. It doesn't just support the idea that we know healthy relationship education is important, but it also can fall over into other areas of the teens' lives, just with conflict resolution, preventing violence and abuse, all kinds of other social interactions. And I think that's very exciting. One question is just a general housekeeping question that Stephanie has asked. I will be posting the PDF of the slides beside the recording of the webinar. Our tech guy is out on vacation probably till Sunday, so it may be Monday or Tuesday until those are actually posted beside the recording, if I get the recording up first. So just keep going back and looking, and definitely Mindy is kind enough to share her PowerPoints with us, which especially when you're looking at all this information, that's really important. Okay, and I think I answered Dana's question. Dana says thank you, and yes, you can get a copy of the presentation, and you can listen to the recording again. Were there any specific questions about the research or about the final when the final assessments are going to be done and be out? So when do you think your final report will be done? How long does that take after you do all your summer and fall things that you're following up with?
Back at our we will complete visits through November, and then do our analyses, and then have results in the spring. I think the project will be fully completed by September 2017. So late summer is probably the latest that we would have results. And we are planning to do a webinar through with Child Trends and OPRE as part of that, to kind of release the full set of findings at that time.
Great. Okay. Dana is asking, do you know of outreach educators? I'm not sure I understand your question, Dana. Do you know of outreach educators about healthy relationships? My school is located in North New Jersey. Are you asking about training in healthy relationship education in North? Maybe if you can rephrase that a little bit for me, Dana, I'm sorry. Okay. Celeste says, Mindy, that she's starting a program for young women starting at age 17, and she would like to have more information on how to partner with smaller businesses or training for smaller business organizers.
Oh, I definitely think that those kinds of partnerships can be very valuable for any type of program, to kind of learn from previous experience and have some guidance and support on that. I think that might need to be tailored to your local community, but sort of reaching out to various other programs, and even some programs that have been in existence for longer, and kind of talking to as many people as possible to get a sense of who might be the best to help with that. But one thing we are hoping to do with our site visits is definitely talk to the healthy marriage and relationship education programs about the types of partnerships they developed, why those partnerships were useful, how they identified those partners in the community, and what sort of support services those partners are providing, and then talk to the providers as well to get a sense of sort of the synergies between their organizations and HMRE programs, and how they sort of work together. So definitely that partnerships piece is something we're really interested in learning more about.
Exactly. Well, and the partnerships are very important. It just brings in more people from the community into the whole idea of how important relationship education is. It gives you more support, not just physical support for volunteers if you need them, but also it can give you financial support as well. So for sure. Okay.
And referrals too. Yeah, source of referrals.
Exactly. And so Dana is back with us. She wanted to know if we know of any outreach educators that teach students healthy relationship education, I guess in North New Jersey. Do you know of any right off, Mindy, in that area of the?
Not specifically. I'm trying to think back to at least the federally funded grantees, and I don't know that they're. I'd have to check. Nothing's coming to mind.
And Dana, I'll look at our customer base and see. I would say that we have quite a few folks in the New York area that do teach healthy relationship education. I'll check for sure to see if we have any communities that are teaching it in the New Jersey area. And off the top of my head, I don't know of any either. But hopefully you and I can talk, Dana. Maybe that's something you're interested in doing in your class, if it's your classroom, in your classroom. So we can talk a little bit about that for sure. And I'll try to touch base with you after the webinar, maybe this week or next week. Any other questions? Okay, well, I'm going to go back and finish up some things here. There is a brief survey at the end of this webinar after you turn it off. If you'll please help us, it gives us a chance to find out who needs to hear from us, if there's other information you might need, but it also helps us to know if this fulfilled what you thought the webinar was the knowledge that was going to bring across to you. And again, there is our link for where you can find the recorded webinar, and wait until probably about Monday. Please keep in touch with us. Here's our website. Here is our Facebook. We have Facebook. Keep in touch with us through that. Sign up for our newsletters. If you go to our website, you can do that. There's all kinds of information. And my email is right here, and I will be sending any other questions or information you might have to Mindy to answer as well. And I'm excited to say that our own Kay Reed, the Executive Director of the Dibble Institute, will be presenting our second Wednesday webinar in August. And that is going to be probably right at when some schools are starting, August 10th. And she'll be talking about the robust relationship skills education, strength-based approach to teen dating violence prevention. So she's going to talk quite a bit about how relationship education can help to prevent teen violence, which is really a big issue right now for teens. So we look forward to seeing you. And I'll be in contact with anyone who writes on the survey that they need to talk with someone at Dibble. And Mindy, again, thank you so much, and good luck with the rest of the assessments and your work.
Thank you so much. Have a good day, everybody.
Okay, bye-bye.
Thanks, bye.